We'll be recording this session very kindly. The recording will be hosted on YouTube and will be accessible via the webinars tab on the TDGR website. So the historical and, this is factual, scientific educational events are being recorded in this way so that we can act as resources that are available to our guild members in the future. Very applicable right now. So if you do not wish to become a part of the recording, but you would still like to watch and listen live, please select stop video and mute yourself. And if you need help to do this, please ask now. And I'll have to have a look up and down the screen just to make sure everyone's relatively happy with what they've got. Yeah, it looks like lots of smiling faces there. That's good. Excellent. No one waving their arms about, and that's great. Okay, lovely. Okay, so only unmute yourself if you're happy to be recorded. The recording will be hosted on YouTube and the TDGR website. Please save any questions until the end. And please, if you could avoid using the chat function. So Phil will just review questions at the end of the session, and we can not record that bit so we can speak a bit more freely. If you participate, please introduce yourself the first time that you speak with your name and your tower, please. Please don't share your screen unless directed to do so by the host. And if you're happy to be recorded today, you can withdraw your consent to be recorded at any time. Please just inform me, the TDGR secretary, if your consent changes. Okay, so I'll stop sharing my screen and I'll hand over to Jonathan just to give a brief introduction for Phil.
Hi, I'd like to introduce Phil Barnes this evening. Phil learnt to ring in Kent before leaving to follow a career in medicine. He spent some time in Oxford and Birmingham before returning to Kent, where he's now the Kent County Association chairman. Phil was invited to help the unenviable task of drawing up the Central Council guidance for the ringing during the pandemic, and is now here today to talk about biological safety in the tower. Phil.
Okay, I will share my screen. Hopefully there's nothing on there that will horrify you too much. Recognise a few friendly faces. I don't recognise any unfriendly faces, which is always good when talking about COVID. Jonathan asked me before starting if I'd been press ganged into this, but in fact, I would say that to some extent I may be, well, not the cause of COVID. Opinions about that still vary, but I was initially asked by Will Bosworth to do a little bit of an assessment of how people could sanitize their ropes in between touches or in between bits of ringing. Because if you remember, when COVID first appeared, it was all about washing your hands and not shaking hands unless you were the Prime Minister, who took a bit of a while to get used to that, but eventually picked it up and has been tapping elbows ever since. And I duly did a little thing for Will in the ringing world, but it became clear to me as I actually worked out what was going on with COVID, that there were probably some risks in towers, not because we're bell ringers, not because of most other things, but because of the rather mixed nature of the buildings that we ring in and how well ventilated and sometimes how dank they are. So to some extent, it's all my fault, so I deserve everything that's happened since. But it has been an all-encompassing idea, and I'd planned to learn to ring handbells on using Maybell on the Mac. The first thing that went wrong was Will phoning me up about COVID, and the second was that my handbell controllers went wrong. So it's been, I've not really got very far on handbells, that's all I can say. So what I want to do is to provide a little bit of advice, and I hasten to add advice about what I think is relevant, to explain some of the reasons for different pieces of advice and guidance, and to provide a few bits of specialist insight. And if I can just tell you a little bit about my professional background, I'll tell you what I'm not, I'm retired, so I'm no longer a licensed medical practitioner, so I can't write you a prescription for anything. I'm still a registered medical practitioner, and I won't go into what that means. I spent quite a lot of my career, early career, doing medical science. So I'm fairly au fait with interpreting scientific literature. And my career at the end was as a medical director and briefly as a chief executive. So I was dealing with the kind of big public health stuff on a reasonably regular basis. Now, that's not to self-aggrandize, it's really just to sort of explain where I see things from. However, I wasn't an infectious diseases doctor. I'm a neurologist, a brain doctor by background. And I'm also not a ventilation engineer, which you'll see the relevance of that as we go through this. And all I want to help each of you to do is to make individual decisions. I spent my entire time as a doctor. You can't tell people to give up drinking or stop smoking. You can tell them it's not good for them, but you can't tell people what to do. And that's certainly the view that I have taken with all of the Central Council advice. There are certain things that have been, not from Central Council advice, but there are certain things that are being incorporated into law. That's a must do. The rest of it is actually just advice, what I would do under certain circumstances and why. So I want to help you. I want to help tower owners, so mainly churches. I think in Truro, probably exclusively churches, and their tower captains to make local decisions. But I stress again, I'm not going to tell you what you must do or what you mustn't do. So what are the risk factors? Because this is all about risk. You don't want to get the virus, you don't want to give it to anyone else. The virus is not just like a bit of flu. And you have to remember that flu isn't a particularly pleasant disease. And a lot of people's bits of flu is probably just a bad cold. Yeah, about between 15 and 20% of people who get COVID end up with some long-term condition as a result.
Give me the date of your first class.
I'm currently hearing someone else. Is there someone unmuted? It would be helpful if you weren't. Thanks. So the risk factors include how much virus is there circulating in the community. And as I'll go through briefly, that's good news at the moment. But not only how much there is in the community, how many different people you meet with, even if there's a lot of virus in the community and you meet with no one, you're very unlikely to get it. That's the basis of lockdowns, obviously. Whether people who are unwell, whether you can stay away from them. And together, that's the risk of being with someone who's infected. Then how much virus an infected person is actually emitting. And there are some people who seem to be super spreaders or super emitters of virus. And it's no fault of theirs. It's just the way they're built, and it's not clear why. But what is clear is that people who are exercising hard or speaking loudly, or sadly for our choir members, singing loudly, there's an increased risk of passing on virus. There is an effect of how close you are to them, how crowded the space is, how much virus you're getting rid of, largely by ventilation, and how long you spend with an infected person. If you have a brief encounter walking past somebody in the street who is infected with COVID, you are far less likely to catch it from them than if you live with them in a 2 up, 2 down. Now, this was the mantra from last May onwards. hands, face, space. And of course it rhymed nicely, and all of our political leaders could remember it, so it was quite catchy. But it was actually, if you'll forgive the phrase, a bit arse about face, forgive the pun as well. The most important of those is actually space, maintaining distance between us. Face coverings are quite important, and they're not just a simple physical barrier. They have other useful effects in reducing viral transmission. But of course, you're actually helping others by not transmitting it to them. They're a better barrier for you emitting it than for you receiving it. And hand hygiene, to be honest, we should all do it, but outside the clinical setting, so healthcare centres, hospitals, clinics and so on, it's not been proven to be a particularly important route of transmission by touch. But as important or more important is fresh air, for reasons that I'll come to. And also, the one thing that hands, face, space, or space, face, hands doesn't really tell you about is the time that you're in a particular environment. And again, I'll come to that. But before we get going with the how to deal with stuff, I just want to put things into the context of today, or more accurately, yesterday. So there are a variety of sources of international and national data. This is a website called Our World in Data. They take their COVID data from Johns Hopkins University, which is a university based in Baltimore, which has got a particularly excellent medical school. And I've picked out a number of countries. And if I can do that and that. So the United Kingdom is in a very good position at the moment. But we mustn't forget that in January, we were in a very bad position. Of this group, which includes some places that have had a particularly bad time, like India and briefly Germany, we were at that time the highest rate in terms. These are cases per million people. We are now down here with Portugal. And although it may not suit the travel industry, actually the list of green light countries is a fairly sensible one if you look at viral incidence. So the message from this is that at the moment, COVID in the UK is doing pretty well, thank you. And this is yesterday's summary. We're vaccinating lots of people. The number of people testing positive has increased a little bit. But of course, you have to remember that we're now about a month, perhaps slightly more than a month from the schools going back. We're now only a week, so that isn't the effect of unlocking. But if you look at the more serious things, people getting into hospital, people dying within 28 days of COVID, it's all pretty good at the moment. And all of these numbers are basically in a good place. It's important to keep an eye on the local data. If I had £1 for every piece of abuse that I'd received from the population of Devon and Cornwall, I'd certainly be able to afford a few post-COVID pints. Because throughout the pandemic, the Southwest has fared well. And there are various reasons for that I won't go into. But it does mean that it's even more important that the population of the Southwest are vaccinated. And again, I'll come back to that. Now, this map on the right, basically blue is bad, yellow is excellent, and green is in between. And it shows that there are some hotspots at the moment. This is Bedford. This is the area Kirklees. This is Blackburn. This is Bolton. This is Glasgow, East Renfrewshire. This is Derry. So there are a few places that are doing badly. And those are the data for tests. It's not terrible, but there are still some hotspots. And you know what that's all about. That is largely about one of the variants of concern, B1617. It's been called the Indian variant, which I don't particularly like because blaming countries on diseases usually doesn't go well. And it's quite particularly sensitive if you're from Kent, as you might understand. Now, these COVID Zoe data, I don't know how many of you have come across this. This is a large study involving about 4.5 million people who every day log their symptoms or lack of symptoms using an app on the phone. And it's run by King's College London, a delightful man called Tim Spector. And he, for example, and this app first told us that loss of taste and smell were classic symptoms of COVID long before any other study did. And it gives us a view, because they use symptoms rather than tests, about a week to 2 weeks in advance of what you will tend to see on the government maps. And again, you will see the same areas, but perhaps a little bit more. This is the area, it's actually the borough of Stratford-on-Avon. So there are a few other areas which may be warming up. But nevertheless, the area of interest is doing pretty well. And then finally, if you're trying to find out what's going on, there's a population survey which is run by the Office for National Statistics and the University of Oxford. And they go round and they swab the noses and throats and take blood from several 100,000 people once a month. It's a completely random study. They write to householders asking if you're going to do it purely by chance. Liz and I, my wife and I, are part of this study. But as you can see, the proportion testing positive for COVID-19 is pretty much down. There might be a little bubble there. But throughout the 4 nations, things are going pretty well. And if you look across the country as a whole, the Southwest again remains in the best position, but possibly in Yorkshire, there is just a slight uptick there. But overall, there's nothing to worry about. Why is this? And it's vaccines. And again, this is just to provide some reassurance to you that the vaccination study, this is all the they're called integrated care service, systems, but basically for you, it's this line, which is Cornwall, the Isle, and the Isles of Scilly. I've highlighted Devon, and this is home for me. And you'll see that if we look over on the right, these are people who've had 2 doses of vaccine in the over 60 age group, and it's going pretty well, although there's perhaps a little bit of a lag over in Devon in terms of the younger age groups. And likewise in Kent, things are going pretty well. So the vaccine story is a pretty amazing story, really. There's a total here of, and this was up to yesterday, 38 million doses have been given. So it's a very large number. Now I'm going to just tell you something that's a heads up, really. And this is to avoid you being scared and put off in the next few weeks. You'll have heard of SAGE, the Scientific Advisory Group for Emergencies, and they've been meeting currently every 2 weeks or every 1 week. And one of the things they have provided advice on is the easing from lockdown. And we've just gone through step 3, you'll recall, last Monday. Step 4 is the full relaxation due on the 21st of June. And these are models from 3 different groups. This is Warwick, I think, Imperial, and the London School of Hygiene and Tropical Medicine. And they've looked at predictions for daily infections, hospital occupancy, and daily deaths as we unlock. Now, it's assuming that we get vaccination levels as good across the age groups as they are. And it also assumes that we don't go completely crazy as we unlock. Not too many raves. But even with that, it is predicted, it is expected, and the government are expecting that there will be a small upkick in the number of infections. Now, because of vaccination, which reduces the severity of the disease, even if in some people it doesn't stop the disease in its tracks, the hospital occupancy and the deaths from that is very much lower. But there is an expectation that there will be a small uptick. Don't panic if that happens. And then finally, just very briefly, everyone is obviously worried about the variant of concern. On this, it's called VOC 21 April 02, the Indian variant for simplicity. And you'll see that in the period since the end of March, it now accounts for nearly half of all of the positive tests. So it has taken off. It is still, however, very localized because such a high proportion of the country's cases are coming from West London, Bedford. I think that's probably Slough, but I'm not certain. That there is, I think, Nottingham, and that is the area around Bolton and so on. But it is universal. But if you look at the southwest, in the bottom right-hand graph, you'll see there are very, very few cases. And from the maps I've been studying in the last couple of days, they are almost exclusively in Devon rather than Cornwall. It does seem that the vaccine works. So again, it's a good reason for having the vaccine. So coming back to what we can do about things. Firstly, let's just talk about some of the evidence for the idea that we keep space between us. Now, I'm sure that those of you who've been following the whole keep your tower well ventilated story will understand that we're talking about aerosols. And there are 2 kinds of droplets that occur, and rather arbitrarily, they are described into droplets, or separated into droplets and into aerosols. Now, there's been a lot of confusion about nomenclature, not least with the World Health Organization, that initially described aerosols as droplets that were less than 10 micrometers, and droplets as anything larger than that. And a lot of the initial advice that they gave, and the reluctance to consider that the virus may travel through the air rather than just landing as droplets on people or on people's possessions, their hands and so on, was due to that. So droplets tend to fall to the ground. whereas these aerosols, by definition, remain suspended. Think of an aerosol. There are two ways that I tend to think of it. One is that think of something suspended in the air. One is tobacco smoke. So you can sometimes walk through a space, walk through a passageway, there's no one there, but there is still a smell of cigarette smoke. That's because of particles suspended in the air. The other is perfume. If you walk through the wake, if you like, of somebody who's wearing some very distinctive perfume, you will smell the perfume, even though they may be 10 or 20 feet away from you by then. So the distance thing is in part due to what we mean by droplets, the things that drop to the ground. And this is a study. There's all kinds of exciting new journals I'm reading. This is the Physics of Fluids last year. And this is in a windless situation. Somebody coughs or sneezes, and the droplets that are produced over time drop all within a 2-meter space. Now, if there's a wind behind them, they travel further. But the 2-meter rule is largely based on those kind of studies. So what about face masks? You know, everyone hates them. They're horrid. They're uncomfortable. They mist up your glasses. So I was wearing my mask for ringing this morning. I was trying to fiddle around with the CO2 monitor, anyway, it was a nightmare. Glasses misting up, etc., etc. So no one likes them. However, they do significantly reduce droplet spread. And they are explicitly, when we were talking about social distancing and 2 meters or 1 meters plus, they were the one thing that we could do in a tower to act as mitigation. And despite a lot of noise, they are not dangerous. They may be uncomfortable. They may cause people to panic a bit. But in terms of physical rather than psychological danger, they're not dangerous. They're just a pain in the derriere. So these are some studies done using an infrared camera. So you're looking at the thermal plume, which is hot air coming out. So in this one, the guy in the sinister dark glasses is just breathing without a mask. And he's saying, just in a normal speaking voice, the word also. And then over here, he's laughing. And you can see that quietly breathing produces less than speaking quietly and a lot less than laughing. If you then put a mask on them, the amount of spread is much reduced. In each case, if you compare that with that, that with that, and that with that, the amount of injected gas is reduced. So what about time? Look at the picture on the right. This is what happens if somebody in a closed room breathes for 60 minutes. So the normal respiratory droplets that become an aerosol in the air, and for which there's good evidence can contain viral particles, will build up over a period of time. And it depends partly on what you're doing. If you're completely silent and just breathing quietly, you get a bit of a build-up over 60 minutes. Somebody talking for all of that time, and I'm sure we know people who are perfectly capable of that, they will emit 10 times as many potentially infective particles as breathing quietly. And shouting some of our favourite conductors, no doubt, or singing, you'll emit a lot more. And in this, each orange dot is one quantum of respiratory particles. So somebody who is infected, shouting or singing in the same space as you for a set period of time will emit 50 times as many particles as if they're quiet. So it's not a simple linear thing. What is the risk of me having one member of the band who's infected? Somebody who's being quite vocal will have a far higher risk of passing it on. And bear in mind that could be you or me. Which brings us to the whole business of ventilation. And why is it so important? Now, there's been quite a bit of, I have to say, bizarre scientific debate. But recently in The Lancet, a couple of weeks ago, there was this paper which really just outlined a number of plausible, sensible, both common sense and evidence-driven reasons supporting airborne transmission. We are well aware that you get asymptomatic spread. So somebody who not only hasn't got symptoms now, but never ever develops symptoms, is found to be the source of infection in other people. So somehow they've spread it. And that's not just people who share a house, they share cups and saucers and so on. I remember a friend of mine who's a medical director in London saying that his entire executive team had gone down with it in the first few weeks of the pandemic. Now, he blamed it on the coffee cups. But when I asked him, he said, well, of course we were we were following hand hygiene and we're not stupid. We were washing everything up. And more likely, one of them, an index case without initial symptoms, was spreading it as they shared office space, boardroom space, and so on. But what's interesting is that, well, I find it interesting, this lady, Tricia Greenhall, is a professor of primary care in Oxford. And yet at the same time, another professor in the same department is swearing blind that there is no evidence for airborne transmission. And the difference seems to be that some are insisting on first grade scientific evidence, randomized controlled trials. In other words, taking half the population and doing one thing with them and half the population and doing something else. And if that isn't present, they say there's no evidence to support it. Personally, I think pragmatically that's daft, but it has sought to both confuse the public and to provide some of those who think that COVID isn't really a thing with a reason to say so. I think anyone who's been in a hospital and seen the mayhem from COVID really can't sensibly think it's not a serious disease. So we know that the spread of disease due to aerosol is going to depend on a number of things. So the rate of virus emission, how much an individual infected person, whether they know they're infected or not, is spilling out per minute. The ventilation rate, because that will help to clear it. How long you are in the space. The longer you're in a space with infection, the risk continues. It notches up minute by minute. There's a bit of an effect of environmental conditions. COVID prefers it if it's a bit cold and dry. And also the number of occupants. So the number of people who are at risk in a particular space. If you've got 10 people there, there's 10 people who will share the same risk. And if that risk is 10%, that means one of them will get it rather than one person having only a 10% chance. So it's important to improve ventilation where it's poor. It's important to be aware of aerosol generating activities, singing, loud speech, exercise. And as I've said, the virus survives better where it's colder and drier. Now, good ventilation is about getting new, clean, fresh air in. It's not just about using fans to keep the air moving about, or to use closed system air conditioners that don't replace the air or filter it, but they chill it and remove the humidity. So in fact, you know, the old-fashioned, think about what you do on a hot summer's day in a stuffy ringing room with no windows. You'll still put the fans on and it can still make you feel cooler, but it's not providing you with any fresh air. And as a simple rule, there are a number of simple rules to think about. If it feels breezy, then you're probably okay. So if you can detect a constant breeze and a draft, it's okay. It doesn't mean cold. You can be cold without the air moving around much, and that's not a good thing. I'll come back to CO2 monitors. We've received a lot of stick about this, and if anyone is interested in knowing a little bit more about the science, I will explain it, but I'll come back to it in a briefer way anyway. So I think if you're in doubt about your ringing room, it's worthwhile checking with a CO2 monitor. Now, I'm lucky where I ring at home in Ruton that we've got an open balcony. We've got a high ceiling and open balcony. There are no external windows other than the fact we've got a 20-foot high window to the body of the church. We're also quite close to the ground floor, so we've been ringing with the door open. And I'll show you some of our data, and certainly just ringing with 4 bells, we don't get any rise in CO2 at all. But I can think of a few towers around here, and those of you who've rung in Kent, St Michael's Maidstone, small room, low ceiling, pokey little windows, always a nightmare in the summer. I've got some anxiety about what the ventilation will be like in there. Ditto, if you think about large numbers of people in a small space. College use practices on a Tuesday evening, you can sometimes have 30 people in a very small space, 12 of them ringing, no ventilation on a winter's evening. I would want a little bit of reassurance that the ventilation is adequate there. But as a rule of thumb, and this comes from a lady called Kath Noakes, who is Professor of Engineering at the University of Leeds and is the Principal Advisor to SAGE on all matters ventilation. If your CO2 levels remain less than 1,000 parts per million, the ventilation's fine. If it gets above 1,500 parts per million, the ventilation's poor and needs attention. So there's some real risk there. So there are some real numbers with some real expert opinion behind them. So what about ventilation then? So there's been an awful lot of work done in the last year, partly at SAGE's behest and partly the Royal Society. The big scientific society have sponsored a lot of work. Now, these are some guys from the University of Cambridge, and these are ways of looking at indoor spread. I'll just talk you through them briefly. So this is an individual in a closed room. This is your standard air conditioning unit, which is taking some of the liquid out of the air. So it's the humidity is being adjusted and it's cooling it off. There's a vent quite high up, but there's no fresh air coming in. One thing that happens when you're standing there, just breathing away, is the heat from your body causes a thing called a thermal plume, which means that the air around you rises like this. So at the moment, as I'm gassing away in my study, it'll be getting a bit stuffy, but it'll be particularly getting stuffy in a plume going upwards. Now, if you've got a really, really high ceiling, that may reduce some of your risk. But if you've got a lowish ceiling, and particularly if you're circulating the air around, whatever bugs are in there in the first place will just be sloshing around. Now, in conventional buildings, one of the best forms of ventilation is called displacement ventilation, where you get air coming in at a low level, fresh air from outside, and going out at the top. So there is fresh air coming in. Now, this is a person without a mask, again, just standing there, and a lot of their thermal plume is going up like this and ending up in a layer of warm air at the top of the room. Now, they're not wearing a mask, so some of their exhaled breath ends up going forwards, and it's going to be a bit cooler. So it's going to end up in another layer around there. Now, too much detail, but it does mean that you can end up in a situation where you have an infected layer up there, but less down here. And I won't bother too much with this situation. This is someone wearing a mask, and it just shows that you don't get this double effect. But if you have really good ventilation, have the doors and windows open, it helps to get a through draft, and a through draft that carries any infected particles up and away. So what's this got to do with CO2? Now, without going into excessive detail, there's a lot of evidence now that you can use CO2 levels as a proxy for poor ventilation and the risk of airborne disease spread. Now, this was a study, I think, from Taiwan, I may be wrong, where there was an outbreak of TB in a university setting. And they used CO2 levels as a way of working out which classrooms and which areas should have their ventilation improved. And it proved very effective. And the thing with CO2 is that it hangs around as an aerosol. The more you breathe, the more you exercise, the more CO2 you emit at the same time as your infected particles. And as I say, there have been studies going back 20 years that show that there's a very close correlation between CO2 levels and infectivity. And the levels change with occupancy and ventilation. Now, you could easily get lost with this, and I'm well aware that it's late on a Sunday evening. These are some numbers that are taken from the same office a week apart in 2017. And they are actually done as a clean air study by this group, which is from Cambridge Imperial and the University of Surrey. And they looked at an office through a 12-hour period of a working day. First on September the 29th. It was apparently a bit warmer then, and the windows were open. These are levels of CO2 in parts per million at different heights. Basically, the lower ones are lower to the ground. The higher ones here are higher up to just above average head height, 2.5 meters. And you can see that the CO2 levels are a bit higher up because of this business of the thermal plume that I told you about. and people are coming in and out of the office during the day, but actually the levels of CO2 don't get very high, and the risk of catching a respiratory virus are relatively low. So that's 1 in 10,000. If we then look at this one here, October the 5th was a colder day. The windows were shut. And although, and we'll come to this area here, although throughout most of the day there were the same number of people in the room, simply by not having the windows open, and this was an old-fashioned office, you know, it wasn't a trendy new office with air conditioning, the levels of CO2 were a lot higher, over 1,000. And this apparently was a spike of 22 people coming in. And if you look in your diaries, October the 5th, 2017 is a Friday, and as was the 29th. So I think there must have been an office trip to the pub then, because the levels go very high. 22 people there, and the levels peak just short of 1,500. So SAGE have provided some advice that we can follow. If multi-occupant spaces, like bell towers, are used regularly and are poorly ventilated, with a CO2 level of above 1,500 parts per million, they should be identified and prioritized for improvement. In spaces where there's likely to be enhanced aerosol generation, singing, loud speech, aerobic activity, and although we're probably not as aerobic as we like to think, ringing could conceivably in there. We should be, this is SAGE advice, aiming to have concentrations below 800 ppm. And we should also think about additional mitigations. So actually a lot of the advice on numbers of people, the duration of activities, and the whole business of ventilation is encompassed in this piece of SAGE advice. Now, if you want to be really clever, there are a number of online tools that one can use which allow you to put in the age group, the kind of room you're in, what you're up to, whether you're wearing masks or not, what the dominant strain is. So at the time I took this picture, it was B117. It'll probably change to the Indian variant, which may be slightly more this way. The percentage immunity, again, when I took this slide, it was pre-vaccination. And then you can fill in a number of things here, including the volume of the room, the kind of things people get up to, do they wear masks properly, etc., etc., etc. And it gives you a safe occupancy level in terms of numbers of people and a safe time. I did this, I also ring at St. Paul's Cathedral. Now, those of you who know that ringing chamber at all, it's a very high ringing chamber. There are windows, but it's a fairly heavy ring of bells, etc., etc., etc. At the peak of the pandemic, pre-vaccinations, the safe ringing time was somewhere between 15 and 30 minutes. So these kind of tools, if you're willing to put a bit of effort into doing some simple room measurements and so on, can help you find out. Now, not everyone wants to know. Not everyone feels that they need to know. But if you do need to know, then that's an interesting place to go. So this is a CO2 monitor. This is actually one of my CO2 monitors. It isn't cheap. I wouldn't necessarily advocate every tower buying one. I think there is an argument for associations potentially investing in some for some of their more borderline ringing rooms. And this is just the graph from this morning at Roughton. This was outside. I brought it inside, connected to the computer. This was the baseline level here after I've been fiddling around with it next to it. Over the period of ringing, it went out like that. Then the service started. I took it outside to dismantle it all. It came down to the background level. So ringing the front four of our 20 hundredweight 8 with the huge open gallery, not an issue. And I suspect that many towers will be the same, but it doesn't mean that every tower will be the same. So what I was going to quickly do now is, while still sharing my screen, hopefully I can do that. So during the course of this, I have been logging. Okay, that's not working very well. In fact, that's working annoyingly badly, but you can see that in my study, we've got up to about 700 parts per million. What I'm going to do now is, despite the fact it's pouring with rain outside, I'm going to open the window wide. I'm going to open the door to my study to get a bit of a draft. And then at the end of the talk, I will come back to show you the effect of ventilation. It is also a bit warm in here, as you can see. So back to the talk. So this is the slide that I showed you about risk factors. What can we do about them? So how much virus is circulating in the community? Well, be aware that all of the data that I showed you are readily available on public websites, government websites, and so on. And you can drill down to a very localized area. Although if you're ringing with people from Lancashire, not that I've got anything at all against Lancashire, you need to bear in mind that their risk will be different. So how much is circulating in the community? Be aware. How many different people you meet with? Well, that's personal choice. Whether they're staying away from people if they're unwell. Well, I think one thing we need to really discourage is presenteeism, or the idea that, oh, I don't want to let you down. If I think about the number of times I've gone ringing when I feel pretty rotten, perhaps I won't do that in the future. And I don't think anyone should object if that's the position that anyone takes. And perhaps for really important bits of ringing, it's important to have some reserves. Because taken together, that's the risk of being with an infected person. Now, as I've said, the whole business of super emitters is no fault. But I think one thing we can do is to discourage shouting. Now, you need to be able to hear your conductor. You probably don't need some of the more outrageous behaviours that are still sometimes exhibited. Now, you can mitigate distance to some extent by mask wearing, but with the exception of one or two towers that have done innovative things by moving their pulley blocks, there's not a lot you can do about the shape of your circle. You can do something about how crowded a space is. And just at first, and I stress just at first, I think it does make sense to limit numbers in the ringing room, to make sure you've got the best possible airflow from outside, and to keep ringing sessions short. And I don't mean 15 minutes, but I do think that pushing it beyond 45 minutes in all but the best ventilated spaces is a risk I wouldn't want to take. And, you know, open disclosure, I've been asked to ring an appeal on July the 15th, I think, and I've said yes, but I've also said that if anyone's unwell, I expect it to be called off, and I hope they don't mind if I bring my CO2 monitoring equipment, which I think will be useful for everyone. Not to have measuring and giving us an answer throughout the appeal, but at least so that we can know afterwards. So what about vaccination? Just very briefly. There's no doubt it provides good personal protection. And most of you will have heard today that that seems to include against the Indian variant, although the numbers of cases for that is still small, but nevertheless, they don't seem to have been in people who have had 2 vaccinations. The one thing that is important to say is that you're not vaccinated until you've had the 2nd jab. And that goes for both the variants that are of interest, the Kent and the so-called Indian variant, but even more so for the latter. We're not quite sure yet if it prevents asymptomatic infection or carriage. We think it probably does. There's early evidence of a good effect on transmission, which is excellent. But of course, the main risk is to unvaccinated people we meet if we're unknowingly infected. And I put this as a question that I'm not going to provide an answer to. But what is your view about ringing with somebody who is a vaccine refuser? Because there are very, 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 very few medical reasons not to have one of the vaccines. I mean, they are vanishingly rare, the medical reasons. And not only what is your view, but does your tower have a view? I think this is something where discussion is really important. So what are the things to do? Still keep the tower clean and uncluttered. Make sure you've got a good supply of Jollop, hand sanitizer. Critically assess your ventilation arrangements. I think it's, don't assume that everything's all right. And it's not so much for now, but when that extra wave comes, heaven forbid, if we do end up with another bigger blip over the winter months, which is not out of all possibility. If you know what your ventilation arrangements are and can show that they're good, you're a lot better position for continuing ringing. If it turns out that you haven't got windows, but you've got something where you can use a fan, use it to blow air in rather than to blow it out. I had one query early on from somebody who'd got a tiny little space. They'd bought an extractor fan. And the advice, which was sort of agreed with by the ventilation experts, was no, don't have an extractor fan, have a pushing it in fan. And if you can put an extractor in the ceiling to take air out at height into a space that's not occupied, even better. Depending on what your ringing room is like, should you be setting a maximum ringing room capacity and a maximum duration? And if you're unsure, consider borrowing a CO2 monitor. I heard a rumour that one may be being purchased for the Truro Guild, and I'm sure we'll hear in a moment. And don't bury your head in the sand, but keep an eye on local infection levels. And especially if you're a tower captain, a tower leader, I think it's important to talk. Some will feel anxious. Interestingly, this morning, there were 2 of our ringers, one of whom I thought probably was anxious, and one of whom I was pretty sure was fairly bullish. And they both described their first trips to the inside of a pub in the last week. And they had both been extremely anxious and nervous about it. So I don't think we can assume that everyone is going to be feeling confident. Some may be. But I think it's important that everyone should be able to go at their own pace and set their own level of risk comfort. And I think peer pressure, which can become bullying, let's be honest about it, really we need to call out and stop at this point. Everyone's got to feel comfortable. Encouragement will go a long way. Pressure won't. Do have open discussions. It's important that your band have a common understanding. And as I say, for important ringing, you might want to think about a subs policy or a reserve policy. And remember, if you are a tower leader, a tower captain, you have dual responsibilities here. You have a responsibility to the church. And there may be occasions, and I'm aware of a few occasions, where the local parish priest has been pretty pushy to get ringing restarted, even when it was actually clearly outside the mainstream guidance. But if your ringers are uncomfortable, I think you need to side with your ringers and respect their views, because at the end of the day, if they go, you won't have any ringers left. So let's see what opening the window has done. So we've gone down from 700 to 400 ppm with a bit of a breeze. So I'll stop there and hope that that has been useful, even if a bit long, for which I apologise.
No, don't apologise at all. Thank you ever so much. That's amazing, Phil. And loads of info there, which has just been really, really good background and very, very relevant for some of us in our spaces going forward. So thank you